Opioid addiction has been declared a national health crisis, and Utah is not immune from that. We want to talk about it with Dr. Jeremy Joyle from Lone Peak Hospital. Hi, Dr. Joyle.
Hi, Jenny. Thanks for having me.
Hey, of course, thanks for being on the show because this is an important topic. And it's when we hear the numbers, it's really scary to hear how many people are dying a day from this in Utah.
Yeah, we're not immune to it by any means here in our community. Utah, on average, has eight people die from opioid overdose or misuse. 80% of the heroin users in our state start with prescription opioids as well, and we actually are trend a little bit higher on average for opioid prescriptions per general population as well. So it's something that we're focusing on for sure.
Okay, and I know that there's people who are doing, this for pain reasons, obviously, and those who are not. So let's talk about those alternatives to the pain treatments rather than reaching for the opioids.
Yeah. So for the recreational opioid users, there's great medical treatments. The medication-assisted treatment is the focus, and there's medications that can be injected that last a month at a time, which really helps with compliance and helping those patients deal with withdrawal symptoms and helps them maintain their recovery protocol better with less discomfort. For patients who use opioids for pain management, it could be either for acute pain or chronic pain. And there's an entire medical specialty devoted to helping patients not transition from an acute injury to a chronic pain condition. Within this medical specialty, we really focus on diagnosing the source of this perpetuated pain. Besides opioids, there are other medications that are useful. There's a multitude of minimally invasive procedures, often done in an outpatient clinical setting. And there are also some long-term treatments, which may include minimally invasive implant therapies to help control pain long-term. Really, the goal is to help patients not develop dependency on opioids, but if they are on opioids, we can help them reduce that dose and keep the risks associated with chronic opioid use as low as possible.
Good. And I almost hate to ask this, but I know with COVID, during the pandemic, substance abuse went up. So I'm assuming opioids are within that as well.
Absolutely. No doubt. Over the last year, there has been, additional stressors that we've all been put under: joblessness, changes with homeschooling, social isolation, and probably limited access to normal treatment avenues has resulted in higher substance abuse. And we've seen that as well across the Wasatch Front.
Now, for anybody who wants to come in and see you and get help, where can they go?
I have a clinic in Draper, and I've got a great affiliation with Lone Peak Hospital. We can be found at lonepeakhospital.com.
Great. Dr. Joyle, thanks for being here.
Thank you, Jenny.